we're going to see each other again. How about you? I didn't know how much I love community links until I wasn't here. How about you? But we are glad to be back. This is our first community links. We kind of followed Brown Bag. We followed what the library did, and we're so glad to be back and kind of stepping back out into our event. So hopefully you'll see us back in the community more and more. And I don't know, you know, when you lose something, don't you learn how to appreciate it even more? And I think over the time, I think maybe that is one thing we all walked away with. And friendship and fellowship is good for the soul, isn't it? It is so good, and it's such an important piece of who we are. And so today, I'm just so glad to be here. I'm glad to be spending time with you. I hope you enjoyed your little Easter dessert bar over there, and we're just happy to be back. And when we come back, we're bringing a new doctor. So I want to say during that time, we wasn't just sleeping over there at Coosa Valley Medical Center. We were still trying to think of how we could bring more, better, greater health care into this community. And our community is not just Sylacauga, but it's Chilsburg and Fayetteville and Coosa County and Clay County. Actually, a community is anybody that will come and be a part and let us be a part of their healthcare journey. So with that said, Dr. Ragsdale, Hilary Ragsdale, is going to come, and she's going to talk, and she's going to tell you a lot about herself. I'm going to let her do that. And guys, some of you's already heard me say this, but she is investing more than just bringing her practice, but she's also living in our community. So I know for some of you guys that means a whole lot to you, and that's important. And she and her family have chosen to be here and to help take care of us. And that is wonderful. So with that said, I'm going to turn it over to Dr. Hilary Ragsdale, and she's going to talk to us about how to take care of ourselves. We were talking about, we've gotten older, right, since we've been gone. I said, well, I have too. But I have learned, and I always heard this, how important your health is. But when we're young, sometimes we don't think about that, right? But the older we get, we realize that our health is important to us, and that journey is important to us. So how can we best take care of ourselves? Well, let's try to make things not happen, right? Let's try to be on top of it. Let's try to catch it before we get too sick. So I think that's really where Dr. Ragsdale is going to take us today. So let's give her and her husband's in the back and her brother a warm welcome to Sylacauga.
Thank you. Thank you. Thank you, Vanessa. Can y'all hear me okay? Okay, perfect. All right, so like she said, I'm Hilary Ragsdale, and I am an internal medicine primary care doctor. A lot of this is really just letting you all know who I am, who my family is. I think that that's really important to have a meaningful relationship with your provider, is to know them outside of the clinic or hospital. And then the second half, we will get into some of the kind of highest yield screening guidelines, and that's the preventative care part. And that's where I am happy to take care of anything that comes up, but if we can stop it, then all the better. So we will get started. So like I said, this is what we're going to talk about. Introduction, actually what the type of medicine I practice. I get that question all the time. What exactly is internal medicine? And then preventative medicine. Okay, so did you always know you wanted to be a doctor? So over here I'm attempting my first bandaging, casting, what have you, on my little brother. That middle picture is me on career day in high school. That I think my dad's doing. His stethoscope, just the opportunity presented itself. And then my favorite on the far right, that's my dad. He's also internal medicine. he actually brought a heart from an autopsy to my show and tell when I was in first grade. So I'm at 6 years old, like, just give it to me, let me touch it, let me hold it, I'm ready. So yes, I've always known I wanted to be a doctor. And there is me and my dad and my son on my first day as an attending here at Coosa Valley. So he got to come round with me, and it was really special. So being a doctor, it is a big part of who I am, obviously, but there is a lot more to me, and I think that just like I like to know the other non-medical things about my patients, I want you to know those things about me too. So here's my family. Top left, wedding photo to the guy in the back with the beard. That is Bo, down here in the corner. He's almost 9 months. Our pups, of course, and then up here is my parents and my 2 brothers, one of which is here also. And this is my favorite because I had just said something hilarious to make Reed laugh, and so then giving him one of the best photos that's ever been taken of him. So you're welcome, Reed. I also really love the outdoors and marine life. I have actually almost had enough to have a second major in marine biology in college, and snorkel and scuba diving, and so there's just some various photos. The biggest bass ever caught in the top right. The top left is in the Galapagos Islands, and then just some various other experiences. We're big fans of the outdoors, and especially on the water. Other things I love, so I love plants. That's the purpose of that. The photo that I took of the cross there is during one of my rotations as a third-year medical student, getting there before anybody else, before the sun comes up. And the bright cross, just the first thing I see as I pull in the parking lot, and just was so reaffirming for me and my purpose. And my faith is very important to me. We love Christmas, so my mom and I with the Grinch, and Hunter and I in front of the tree with our pups. A big Harry Potter fan, so there's me next to the Hogwarts Express in the bottom right. And then these 2 down here, my best friends. Those are my crew. The top left, I know it looks a little weird, but Reed and I actually got to go, not this past March Madness, but the last time UAB was in the basketball tournament, and we upset our 13th seed. And so Snapchat was doing a special thing for March Madness, and we actually got Snapchat famous off of this photo for the whole world to see. So now that's one of our favorites. So that's me, a little bit about me personally. As far as my training, I didn't go very far. So 3 years spent at UAB, getting my bachelor's of science in biology, and I minored in chemistry. Graduated summa cum laude, and then I was in a science and technology honors program, which is where you learn the processes of laboratory medicine, and so knowing what goes on in that aspect, when I'm practicing it clinically, is very helpful to understand how that translates. Next, I did 4 years earning my MD at UAB School of Medicine. I was inducted into the AOA Medical Honor Society, which the top 25% academically students are eligible. The top 10% of that top 25% gets elected. And then I was also an infectious disease scholar, meaning that I had a special interest in infectious diseases, and wrote several papers and topic outlines for various journals. Finally, 3 years of residency training in internal medicine at UAB. I was the women's health chief resident, so we're one of only 3 programs in the country that has a sub-track for women's health within internal medicine. And so I was chief resident of that program. I got the Intern Spirit Award, which just means enthusiasm for medicine. And if you don't know that about me by now, just send to this presentation, then, you know. I also won Outstanding Clinic Performance and Outstanding Senior Resident Award at graduation, and just loved my training there, and was very lucky to have such a good experience, but I was ready to get out into the community and get out of academics a little bit. So why I chose internal medicine, it's what it is we are trained to manage the entire person comprehensively. We prevent, we diagnose, and we treat a broad spectrum of illnesses, whether that's something acute, meaning short-lived, chronic, meaning you're going to deal with it for a long period of time, whether it's common, whether it's complex. Also, I love, and the reason why I chose to stay general internal medicine is I'm not confined to one organ system. I couldn't pick one that I love the best, so I love them all. And we are specifically trained to solve those puzzling diagnostic dilemmas, and then manage the coexisting conditions as well. So we use the best medical science available, and then we apply it to each individual patient, meaning that I'm really passionate about not having one script for every person, and really taking each person and their uniqueness into my practice and doing it thoughtfully, meaningfully, and to me, that's really what the art of medicine actually is. Sometimes we're referred to as the doctor's doctor. We're often called upon by other physicians to help kind of solve the case. And so if any of you have ever watched any of the medical shows, a lot of them, their surgeons mixed in with the internists are always the ones that are coming in trying to figure out what's going on. So that's us. So there, you have a choice. You can subspecialize, so that's your rheumatologist, your cardiologist, your GI doctors. All of them had to start with internal medicine. And then you have general internal medicine, or GIM, is what you'll hear it referred to as. And so essentially upon completion of training, we go straight into practice as experts in diagnosis, treating of chronic illness, and in health promotion and disease prevention. And again, not limited to one organ system. And that can look different. So there's the traditional, I should not use traditional. When you typically hear primary care, people think just the clinic as your general doctor. Then you have hospitalists who only see patients in the hospital. And then you have a traditional style primary care, or what I like to, the term I've heard and like the best is a complexivist, where you have your primary care clinic, then you also see your patients when they go to the hospital, and then you also follow them to the ICU, which is very unusual. Not many places do that anymore in Alabama, and even a lot of the places that do, you're not allowed to follow them in the ICU. So the fact that I could do all and be with my patient from the first time I see them in clinic to the most vulnerable was really important to me, and Coosa Valley allows me to do that. We are different than general practitioners in family medicine, who they train on many more things that I am not equipped to handle, meaning pediatrics, pregnant people, and surgery. Thank goodness for my family medicine colleagues, because I can't tell you how many times I've said, I've got a call on a 2-year-old, what do I do? Because that's not me, so I am specifically adults. How we landed here, so like I said, this is one of the only places that really allows that true complexivist traditional style care. And then Hunter and I knew that once we started our family, we wanted to find a community to grow in that was tighter knit, get out of the metro area a little bit, and then was still kind of showing some promising growth, knowing that we were going to have children. Bonus points if it was near the water, because we both like to fish, obviously. So after we spent a little bit more time in the area, the vision we had for our family, it became very clear, and we're committed to living, working, and growing here. So we live here, are kind of working on making a house our own right now here in Sylacauga, and Bo will grow up here and plan to be here for the long haul. Okay. So preventing illness is a big part of my job as a primary care provider. So how do we know when and how to do it? And I know sometimes I can feel sort of random, like why am I all of a sudden, my doctor's telling me it's time to do this, it's time to do that. Like how do we know when to do this? And the answer is that there is an entire task force that is made of volunteer panels of experts. And then they grade their recommendations based on their research and their clinical experience. So grade A recommendations is they know with a high certainty that the benefit of a certain screening is substantial. B is they recommend it because there's a high certainty that the net benefits is moderate, or there's moderate certainty that it's substantial. C is essentially says, talk to your patient and figure it out. And D says, we recommend against it. And there's a little helpful app down here I put in the corner. It's just USPSTF Prevention Task Force app. And you can actually put in your age and your characteristics, and it'll tell you what screenings you should be doing. So I'm going to run through a few of the A and B, so the high certainty and moderate certainty recommendations for all patients. The first one is one a lot of people don't know about. So an abdominal aortic aneurysm, which is where the big blood vessel that runs from your heart to the rest of your body, as it runs through your stomach, it can dilate over time for various reasons. And men aged 65 to 75 who have ever smoked, there's no amount, you need a one-time screening with an ultrasound. So this is very underdone. Colorectal cancer screening, I think that we all probably heard a lot about that one. I put a star here because this is sort of changing actively, and there's different ways to do it. But how I have it here is they recently changed that for grade B, meaning with moderate certainty, they're thinking we should probably start earlier at 45. And high certainty, we should do it from 50 to 75. Now, there's multiple options, like I said, but most definitive is the full colonoscopy. And then if that's normal, it's only every 10 years. So that's how I convince my patients. Even if it's abnormal, it's still a little bit of time in between typically. Hepatitis C and HIV, every adult, it's recommended with high certainty. Between 1879 for hepatitis C and 15 to 65 or a one-time blood test, you would be amazed the people that haven't ever been tested, and usually negative, but it's recommended as part of primary care. Lung cancer is a big one, so adults aged 50 to 80 years old who have a 20-pack year history, which means that if you multiply the packs per day over the years that you've smoked, if it's 20 or higher, and they currently smoke or have quit in 15 years, that's a CAT scan every year. The diabetes screening, every adult, asymptomatic adults aged 35 to 70 who either have an overweight or obese BMI, and that's just a blood test called an A1C. And then cholesterol, we're looking at that to prevent cardiovascular disease. All adults aged 40 to 75 should get that checked, and that's also a blood test. Women's specifically, A and B recommendations. So the breast cancer screening is another big one. Women aged 50 to 74, this is the USPSTF. Different societies will kind of have different guidelines, but the official recommendation is 50 to 74, and it's every 2 years. The American Cancer Society has those that you can see below. So the option to start at 40 and then moving from 45 to 54 every year, and then 55 and older, you can switch to every other year. I found that really going either way, I haven't seen too big of a difference. It's really just a discussion with the patient. Cervical cancer screening, this is also new and exciting. So for those of you that have had this done, you know that it's not the most fun, most comfortable thing you ever have to do. And so ages 21 to 29, if you just look at the cells, you only have to do it every 3 years if it's normal. 30 to 65, you can just look at the cells every 3 years, or if you test for HPV with it, every 5 years. So there's no more yearly exams for this. And you can stop at 65 if you've had adequate screening, and that assumes you have normal results up to this point. But lots of women are celebrating this, that there's no more necessary for yearly testing. And the last one on here is osteoporosis, ages 65 and older, or postmenopausal women younger than 65 who are at an increased risk should get screened for osteoporosis, and that's a bone scan every 1 to 2 years typically. The big category C, meaning the category where you decide with your patient, is prostate cancer screening. What they say is men aged 55 to 69, and the reason it's grade C is that it usually offers a small potential benefit of reducing the chance of death from prostate cancer in some men, but many men will experience lots of harms from the screening, including false positive results, complications from biopsies, etc. And so you should really base the decision to do this on patient preference, discussion, family history, risk factors, that sort of thing. So that's the big sort of one category C that's in the spotlight right now. So the point is I want to see you before you develop chronic illness. And help you live your longest, your healthiest, your most joyful life without ever having to treat them because we pursued the proper screening. And even if we do need to treat them, we catch them early. And even if we don't achieve that goal, I'll still be here to work with you, and we'll take care of all of it, like I said, either acute, short-lived, or long-lived ailments, and get you back to the healthiest version of yourself. And millennials and younger, so spread the word. This means you too. So there's a big movement right now that urgent care is primary care. And urgent care is absolutely wonderful and necessary and essential to avoid overwhelming the medical system. But I encourage everybody to have a primary care physician because urgent care does not replace primary care. When you get to know your provider before you get sick, then the care you get when you're sick is that more personable. And then here's just a few of my areas of special interest. So mental health care is very important to me. So anxiety, depression, I treat that frequently and enjoy treating it. I am a women's health expert, but I don't see only women. One of my patients came in and he said, I feel kind of weird because I think you're a lady doctor, right? And I said, no, I see men too. It's just that I do women's health. Medically supervised weight loss is another one, and infectious diseases. So something to remember, the absence of symptoms is not always equal to the absence of illness. When you do become sick and you're at your most vulnerable, having a primary care doctor who's gotten to know you over a period of time can lead to earlier detection of chronic illness and a more accurate and timely diagnosis and treatment. Everybody should have a PCP, and I would be honored and would love to be yours. That's why I'm here. So there is my information, and I think Vanessa and Lindsay also have it like plastered everywhere as well. But I am in the professional office building over by the hospital on the 3rd floor, Suite 300, and I would be delighted to see you. And I think that is it. Yep.
All right. Hey guys, do you have questions? We've always, okay, here we go.
Can they measure your IQ?
She seems pretty passionate about it, doesn't she? But that's what we want, right? We want a physician that wants to take care of us. I mean, we all want that. What other questions do you guys have? Okay.
Yes, ma'am. So how it works is I'm in the clinic during the day, and if I have either admitted any of my own patients myself or they've come through the ER, I will round on them. I also take call, so even if one of my patients gets admitted while I'm not necessarily on call, I still see them the following day or if I'm on the weekend. And then occasionally we take call for patients who don't have primary care providers in the community every so often, and I do that too. So, yes, ma'am.
What other questions do you have today? Anybody? That's some great information, isn't it? It is. It's something you remember what I said when we started. We need to try to take care of ourselves before we get sick, right? That our health is so important to us. And until we start seeing things that are not as healthy on us, then we don't realize that. So let's just take the challenge today to get connected to a primary care. As we said, Dr. Ragsdale is open. We've got magnets right here. You can find her. You can call her. She would be happy to take care of you. She'll be happy to sit and listen. And, you know, at this point, we may have several things that we want to talk to her about. And she'll be available a few minutes afterwards. If you want to ask her some questions privately, we can do that. We are glad to be back. We'll be back again next month. So, you know, we're a little bit, we're missing some of our friends. And I know over the past 2.5, 3 years, you know, we've got people that are no longer with us or maybe are not able to get out. So I need you to help grow our community links back. So what I need for you to do is go out and talk to people, share the word, talk about the good dessert and the great speaker, all those things. And then, of course, we'll need to take a break for the summer so our children can come into our library. But we will be back next month. And a good time to gather and talk and learn and try to make sure our health journey is as great as it can be. So